Welcome back, everybody, to the deep dive. Today, we're taking a look at a developing situation in the Democratic Republic of Congo, a disease outbreak that has officials all over the world on edge. We've got reports coming in from all over Italy, Hong Kong, and we're going to try to sort through everything and figure out what exactly is going on in Congo, what we know about this new illness, and what it could mean for the rest of us.
Yeah, it really is a stark reminder that with all the progress we've made in medicine, we're still susceptible to new diseases. And these early reports, it's like trying to assemble a puzzle with only a handful of pieces.
Let's start putting those puzzle pieces together then. So our story starts on October 24th in the Panzi Health Zone. It's a remote area in the southwestern Kwango province, about 700 kilometers southeast of Kinshasa. And get this, national authorities didn't even know about this outbreak until December 1st.
Wow, that delay, that's a problem.
Mm.
It really highlights the challenges of tracking diseases in places that don't have the infrastructure or resources. And in Kwango, well, they've got another huge problem. 40% of the population is malnourished. That makes people much more susceptible to getting sick and staying sick.
So we're talking about a region that doesn't have great health care, has high malnutrition, and now this mystery disease. How does all that impact how well people can fight off something like this?
Well, it creates, a perfect storm for a health crisis
Yeah.
because malnutrition weakens the immune system. So people are more likely to get sick, and it's harder for them to get better. And then on top of that, they don't have good access to health care. I mean, even a relatively minor illness can quickly become life-threatening in that situation.
You might be thinking, okay, this is bad, but what exactly are we dealing with? Well, a lot of reports are describing this illness as having flu-like symptoms, fever, headache, coughing, trouble breathing, that sort of thing. But there are also reports of vomiting, really bad headaches, muscle pain, and here's the thing that really sticks out. Anemia seems to be a big problem, too.
Yeah, that's not your typical respiratory illness. Anemia, it's when you don't have enough healthy red blood cells.
Mm-hmm.
And that tells us that maybe this disease is messing with how the body makes those red blood cells, or it's even causing internal bleeding.
Right.
That really raises the level of concern.
It does, and to add to that concern, 40% of these cases are in children under 5. We know how vulnerable young kids are to diseases, so that's a big red flag.
Absolutely, it is. And sadly, we're already seeing a really devastating impact. Initial reports said there were 27 deaths, but those numbers are changing fast. Some sources say 79, some say 143. The BBC says 71 confirmed deaths. It's a stark reminder of how fast a new disease can take hold, especially in vulnerable populations.
And it's spreading. It's reached 7 out of the 30 health zones in Kwango province. And to make things worse, reports say that 10 of those deaths happened because there wasn't enough blood for transfusions.
Wow. That just goes to show you how bad the lack of resources is in the region. A blood transfusion is a pretty basic procedure. It can be the difference between life and death, but a lot of people there just don't have access to it. It's a clear sign that we need to invest in healthcare infrastructure in these vulnerable areas.
It really is heartbreaking. So let's talk about what might be causing this. Right now, tests are showing that it's a respiratory illness, but we still don't know the exact pathogen. Some sources are even calling it disease X. That sounds pretty ominous.
Uh-huh. Yeah, it does, doesn't it? But actually, disease X is just a term the World Health Organization uses. It basically refers to any unknown pathogen that has the potential to cause a serious international epidemic. It might not be a brand new virus or bacteria. It could be one we already know, but it's mutated, or maybe one that's been circulating undetected in animals.
So it's like a medical detective story. You got to rule out the usual suspects before you can focus on the real culprit. What are some of the ways they try to figure this out?
So the WHO is investigating. They're collecting samples for analysis and looking at all sorts of possibilities. Could be a respiratory pathogen like the flu, maybe even a new variant of COVID-19. Also considering things like malaria, measles, bacterial infections like meningococcal disease. So by ruling out those common causes, they can focus on what's left. Maybe something less common or something totally new.
It's really interesting how they narrow it down. Now, it's worth noting that the DRC just dealt with an outbreak of Mpox. Does that have anything to do with what's happening now?
It's not directly related, but the Mpox outbreak does show how vulnerable the DRC is to infectious diseases.
Yeah.
I mean, this is the country that's had to deal with Ebola, hemorrhagic fevers, the ones that cause serious bleeding, and all sorts of other outbreaks. So this experience, it could help them respond to this new disease, but it also puts a strain on their resources, which are already stretched thin.
It's a tough situation. And as the world reacts, that experience with past outbreaks could be really important. We're already seeing places like Hong Kong and Italy increasing their health screenings, especially for people traveling from Congo. So even though the outbreak seems to be contained to that region for now, it's obvious that the world is paying attention. Why is that?
Well, because nowadays everything's connected, right? A disease outbreak anywhere is a potential threat everywhere. You don't even need direct flights from the affected region for it to spread. People travel, goods get shipped. It's easy for a virus to hitch a ride. That's why international cooperation is so important.
Yeah, it really makes you think about how connected we all are. It's like that saying, a single spark can start a fire. And in this case, that spark could have global consequences. What does that collaboration actually look like in a situation like this?
Basically, it's about sharing information quickly and openly, coordinating efforts to track how the disease is spreading, and giving support to the countries that are affected. That could mean sending medical supplies, personnel, expertise, anything they need. The main goal is to contain the outbreak and prevent it from becoming a pandemic.
So what you're saying is we can't afford to just ignore this, even if it feels like a problem that's far away. We need to understand what they're dealing with on the ground. You mentioned earlier how hard it is to diagnose diseases in remote areas. What are some of the biggest obstacles they're facing in the DRC right now?
Well, just think about it. If it's tough to diagnose a disease in a country that has good resources, imagine what it's like in a remote area of Congo. They don't have advanced labs, transportation is limited, and this area, Panzi, it's really isolated.
So getting people and supplies in and samples out, that's a huge logistical challenge.
Exactly. And then there's the problem of limited lab capacity. If you want to accurately diagnose this illness, you need sophisticated labs that can do complex tests, like genetic sequencing. But those labs are hard to come by in developing countries. And even when they have them, getting samples from remote areas to those labs is really difficult.
It's like trying to solve a puzzle with half the pieces missing. And even if they do get those samples tested, there's still the question of expertise. You need trained professionals who can understand the results and make the right diagnosis.
You're right. Building that kind of expertise takes time and resources. It's a crucial piece of the puzzle. And even if you do have a diagnosis, there's still the challenge of treatment. A lot of the effective medications are expensive and often not available in these regions, which makes it even harder to fight the disease.
So many challenges. You talked about the poor sanitation and lack of clean water in Kwango before. How does that play into all of this?
It's a major factor in how infectious diseases spread. Without good hygiene and sanitation, diseases can spread like wildfire through contaminated water sources and from person to person. It basically creates the perfect environment for outbreaks, making it much harder to contain them.
So we're dealing with a whole bunch of interconnected issues. It's not just about figuring out what disease X is. It's about addressing those underlying problems that make these outbreaks more likely to happen in the first place.
That's exactly it. This outbreak is really a symptom of much deeper systemic problems that need our attention. Investing in healthcare infrastructure, improving sanitation and water access, addressing malnutrition, those are all crucial steps to prevent future outbreaks.
We've covered a lot today, from the first reports of this outbreak to the global response and all the challenges the DRC is facing. It's clear that this situation is really complicated and really concerning. It's a lot to process. So let's take a minute to recap what we know so far. We've got a mysterious disease outbreak happening in a remote part of Congo, already causing a lot of deaths, and it's spreading. We don't know the exact cause yet, but it seems like it's some kind of respiratory illness.
Yeah, that's right. They're working hard to figure out what it is, but time is definitely a factor. They're trying to contain the spread at the same time as they're trying to treat the people who are already sick.
And we talked about those challenges they're facing in the DRC. They don't have a lot of healthcare resources, sanitation is poor, it's hard to even get medical help and supplies into those areas.
All those things make this situation even more worrying. It's a reminder that there are huge gaps in healthcare around the world.
And it leads us to a big question. How might this outbreak affect other countries, even if there aren't any direct flights from Congo? Just because there aren't direct flights doesn't mean there's no risk. In today's world, disease can travel across continents so fast.
Absolutely. We've seen it happen before with SARS, with Ebola, with COVID-19. Something that starts out small and localized can escalate into a global problem in the blink of an eye.
It makes you think about how vulnerable we all are. So as we learn more about this outbreak, it's important to ask ourselves, what can we do to protect ourselves?
The best thing you can do is stay informed. Keep up with the latest news from reliable sources like the World Health Organization and the Centers for Disease Control and Prevention. They base their information and advice on the latest scientific evidence.
And don't underestimate the power of simple things. Washing your hands frequently, staying home when you're sick.
Those basic steps can really help to slow down the spread of disease. And if you're planning to travel internationally anytime soon, be sure to check for any travel advisories or health recommendations.
This outbreak in Congo is a wake-up call for all of us. It shows how interconnected we all are. What happens in one part of the world can have an impact on everyone, everywhere.
That's right. It underscores how important global health security is. We need to work together as a global community to prevent these threats and respond to them effectively when they do arise.
It's a reminder that we need to stay informed, stay vigilant, and work together to build a healthier and safer world for everyone.
Couldn't have said it better myself.
Well, that's all the time we have for today's deep dive into the Congo disease outbreak. We'll continue to follow this story closely and provide updates as they become available. Until next time, stay curious, stay safe, and stay informed.